Thanks, everyone. I'm going to talk about, the title is Queer Men in the UK Negotiating Biosexual Citizenship During COVID-19. And really, this is a project that, or a paper that I wrote collaboratively with my colleagues, Jamie Hakem and James Cummings, as part of the Digital Intimacies project that we ran during the pandemic. So a little bit about the project. Digital Intimacies was an ESRC funded project that ran until well, earlier this year, but we did data collection in 2020. And it was really looking at how queer men use smartphones to negotiate cultures of intimacy. And as with everyone in the world, our project changed with COVID descending on us in the UK in early 2020. So we ended up doing a lot of our data collection, or most of our data collection during COVID, shifting to online interviews, as most all qualitative researchers seem to do. So we undertook 43 interviews with queer men in London and Edinburgh between July and January 2021. I won't go into the details about the participants. I can tell you all about who we interviewed, but really this is about looking specifically at how some of our participants negotiated intimacy and intimate relationships during COVID. And it draws on an article that came out as part of a special issue on pandemic citizenship last year, but it won't speak directly to the article. I'll lift bits and pieces from the article. But just to give you a bit of a sense of where we collected the data, or when we collected the data and COVID in the UK, because I'm aware that not everyone is as up to date on the COVID experience in the UK as those of us who lived through it might be. There were different public health policies in relation to COVID across Scotland and England. Now, the four nations of the UK did harmonise a lot of their policy, but there were different ways that those policies and interventions were applied. So there are slight differences. So when I talk about Scotland and England, there were some important differences in terms of when lockdown was lifted or when restrictions were lifted. To summarize, we had a number of national lockdowns, or in other countries it's called sheltering in place. The first one was March to July 2020, and then there were a number of various regional, local, semi-national lockdowns in the kind of second half of that year. And then we, of course, had another big lockdown in the January or end December of 2021. And that's at the point where we were doing the interviews. So this is, if you can imagine, our participants were very much embedded in this kind of environment. And as other places, there were a number of restrictions, a number of things put into place. But perhaps more importantly, for the purposes of this talk, is that there was a new regulation brought in June 2020, which the wording is, it forbade a gathering when two or more people are present in the same place in order to engage in any form of social interaction with each other or to undertake any other activity with each other. And this colloquially was known as the sex ban, or joked about as the sex ban. Because you couldn't meet up with partners or people with whom you didn't live. They subsequently brought in what was known as bubbles, or support bubbles, or extended households. But this took a fairly heteronormative approach in that it was largely framed as providing support to carers, so providing extended family access to homes, grandparents looking after children, that sort of thing. And it really kind of imagined that you were living with your sexual partner, you had one sexual partner, and you were living in an environment, in a household where you were free to kind of live as you wanted. And I think that it's important to kind of keep these things in mind as I get into the kind of experiences of our participants. Just to note, even though some of us have had access to vaccinations, there were no vaccinations available at this point. And I know our memories might be patchy from the early days of the epidemic, but or the pandemic, but this was very much before vaccines were even kind of available. And eventually now we see a real dropping off of all mandatory public health measures in the UK. It's as though pandemic never happened, which is a whole other subject of a seminar that we could get into. But what I want to focus on today is the kind of the focus on, or the experiences of queer men, and in particular the sexual health advice, the sexual health experiences of queer men in the UK. And really early on in the pandemic in the UK, the big sexual health organizations came out and said, advised for abstinence, or advised that sex only within your household. And it was really, I think, quite surprising, perhaps not surprising, given we had no kind of biomedical tools to mitigate COVID at that point, other than isolation. But I think the kind of advocating of abstinence, you can see the image on the bottom with Michael Brady, who's the clinical medical director of Terence Higgins Trust, suggested no hookups during lockdown. And this kind of extended to some of the HIV clinicians, I think in London, but perhaps across the country, thought this might be a great chance to end HIV. If no one is having sex, if we can test everyone, if we can get everyone, kind of stop them in their tracks and test them, and we could stop the transmission of HIV. And colleagues, kind of Ladina and Whale, have written a little bit about that. Obviously that didn't happen if you haven't been paying attention to that. A couple of organizations didn't take the abstinence approach. They advocated really more for a harm reduction approach, and I think really reminiscent of community responses to early HIV and perhaps throughout the HIV epidemic. They came up with this fantastic website, which is still there. If you go to that link, it's hidden, but you can find the link, and they've got a whole raft of information about how to keep yourself safer if you need to, or have to, or want to engage with others during kind of that point of the pandemic. And I think they did some really important work to think about, well, what if you have to have sex, if you're a sex worker, or if you need that contact with someone else, or if you're in a hostile environment, and what are the things you can do? And I think it's important to think here about, I won't go on too much more about the links between HIV and COVID, but there's a good special issue in culture, health, and sexuality about this. But I think that giving that context, or setting up that scene, I'd like to kind of bring us into conversation around, or just thinking about citizenship. And when I talk about citizenship, I don't mean Scottish or Canadian or American or South African citizenship. I mean citizenship in relation to self-governance, in relation to thinking about how we govern ourselves and how we are with others. And a lot of my work previously has looked at, and still does to an extent, biological or bio-citizenship. And here thinking about Patrina's work in relation to post-Chernobyl, or Nicholas Rose's work in relation to genetic testing, really thinking about what is it that people expect of the state, how do they mobilize their own bodies or their own communities to access services, or to make demands of the state and each other. And in a paper I wrote with Mark a couple of years ago, we defined HIV citizenship. We looked at people's own experiences of living with HIV and treatment as prevention, and we defined citizenship there as governed through both rights and responsibilities, the rights to biotechnologies, treatment and care, and the responsibility for the health and well-being of oneself and others. So thinking about what are you entitled to, and what are your obligations to kind of match that entitlement. And of course, HIV citizenship is not just about those living with HIV. It applies to all those engaged in or affected by biosocial entanglements with HIV biotechnologies. And this has really been important in my work in relation to PrEP, or pre-exposure prophylaxis, when I've been thinking about and working with different activists who've been making demands on the state, on the health service, or on sexual partners in relation to HIV prevention and accessing these services. But of course, also sexual citizenship plays a really important role here. And I think here I draw on people like Diane Richardson, who has talked about sexual citizenship as access to a system of sexual rights. it's a complex entanglement of conduct, identity, and relationship claims. So she's like, it's not just a set of rights. You aren't entitled to rights as a sexual citizen. It's about your engagement with that whole nexus of identities and relationships, and also normative assumptions about sexuality and sexual practice. And here is where I think it's important to bring in the world of sexual identities and rights and practices in relation to biology, biomedicine, health, those sorts of things. And conveniently, a couple of years ago, Steve Epstein wrote a chapter on biosexual citizenship. And this has been a really important kind of framework for me to think through the work on PrEP activism, but also very much within the context of COVID with our participants. And he talks about biosexual citizenship as where biological and health-related processes are brought into some relation with sexual meanings and identities. And in that chapter, he's looking more at the kind of sexual health services and institutions and the history of that. But really, it's about looking at the kind of embodied pleasures and risks of sexuality and how that figures in the world of biomedicine and health. And so it's for us, in my digital intimacies project and elsewhere, it's really looking at that interplay. And so I use the term biosexual citizenship broadly just to help frame or think through, well, what does, not just about rights and responsibilities, but what does care look like, and care for oneself, care for others, and how did queer men in the UK, what was care for them? And what was necessary. So what were the implications of how they followed guidance or didn't follow guidance when it came to COVID? And what were the implications for intimacy, either physical or otherwise? And so for the remainder of this talk, I'm going to just touch on some of the examples from our work where our participants talked about how they navigated or how they negotiated what I'm calling biosexual citizenship, or how they lived really in the context of the pandemic, but also in the context of queer communities and intimacy. So the first example was Will in his kind of experiences of following the rules, really, and of trying to really stay in lockdown and attend to himself. And he talked about, we did the interview kind of a few months after Scotland came out of or eased restrictions, and he talked about how he had 4 or 5 months where he had absolutely no intimate contact with anyone. And so there was someone he began to see, and I'll read out the extract because I think he says it quite nicely. He says, and there was a guy that I started to see casually. We agreed in August when some of the restrictions were being lifted and the bubbles were coming in. He was like, I'm on my own for a week, you're on your own for a week, let's just kind of quarantine and then we can see each other. And I thought this was a really lovely example of how Will and his partner were, or his potential partner were interpreting what the rules were. So there was no requirement for folks to quarantine, but taking those extra steps to go, okay, well, we've not seen each other or anyone else for so long. Let's just be extra cautious and let's put into place some of these rules that we've understood to be the case in relation to COVID. And so I think this is one example of where the men that we spoke to were really trying to implement those rules as best they could and applied in individual cases. The second example I want to talk about really is about bubbles. So remember at the start, I talked about the extended household or the bubbles and how they were brought in early on, and how you could only have a bubble or an extended household with one other physical household. And Jacob, who I spoke to in Scotland, talked about the difficulties really of forming bubbles. And he said, I'll read it out. He said, I reached out to one of my friends who I thought was most likely to be up for creating a bubble. But then again, I know that they live with somebody and they also have other people that they would maybe consider for similar setups. I didn't want to come on too hard, and that didn't happen. The people that I surround myself with are mostly queer and mostly kind of polyamorous or polysexual. So obviously that eliminated that person from the list. And I didn't really see any other people who would either want to or they would be in a position to form a bubble. And I think Jacob talked about really missing that intimate connection, but not being able to form those connections and those bubbles or those extended households that really suited him or that really met his demands, and the attention to not asking other people because he knew they would be in a similar situation or they would make other arrangements, or thinking about that there were only a few people he would be willing to ask, meant that it didn't happen for him. He wasn't able to form these bubbles. And I think it's really important to think about where the extended households were framed as caring, that this failed, this policy, even as he tried to apply it, failed to meet his needs, and so he ended up not forming a bubble with anyone. When it comes to managing hookups and PrEP, Jack talked about his own experiences of the differences between house sitting for someone, for a friend, where he said there were a lot of queer men around, so I had a lot of sex. And then with the pandemic, it radically changed his life, his experiences, and his ability to connect with others. And he talked about using particular, I suppose, biomedical markers, the R rate. I don't know if anyone remembers them talking about the R rate in 2000, or maybe they're still talking about it in some places. But he talks about using the kind of the numbers of infections and the R number in relation to also when he goes on to hookup apps and his own taking of PrEP. And he says, I'll read it. I went on to the hookup app the other day and I was like, well, what are you doing? The R rate's high and the infection rate. So again, I'm at the stage of, should I come off PrEP for a bit? Because there's no point in being on it if I'm not taking my PrEP. That's another thing that's going to discourage me from going on the app. It's getting to the stage where it's not safe to be doing it. It's hard to know what's for the best. What do I think about this infection rate? What are they saying the R rate is? And sort of judging it off of that. So at the moment, I'm locking myself down again. And I thought this was really important to look at both how he used PrEP as a way to stop him from going on to the app. So stopping taking PrEP was another way that he controlled his own kind of practices of going on to the apps, because he was worried about the infections, because he was worried about the rates. And I think looking at the strategies that he employed, and looking at the information he drew on, is an example of how he was regularly checking in with, is it okay to be going onto these apps? Is it okay to be hooking up, or is it not? And when should I take a break? So it's not that there was a lockdown and everyone kind of, jumped out of their flats and went and had all sorts of hookup rates. Jack and others were constantly checking in and employing all sorts of kind of strategies to make sure that they were safe to the best of their ability or the best of their knowledge. The last example I'm going to touch on briefly here is Gareth and his experience in London. And I want to just comment that a lot of our participants talked about really trying to follow the rules, really trying to stay safe, to care for others. One participant said to me, I wouldn't do that because I don't want to be the person to give someone COVID. And I think that there was a lot of concern in 2020. We didn't know a lot about COVID. There were all sorts of concerns, and I think our participants really reflected that uncertainty. But it didn't mean they didn't attend to or think about their intimacy, their intimate relationships, and their needs. And I think Gareth's example is a really nice example of where some participants were negotiating the rules as a collective, so not as an individual, and should I hook up with this person, or should I quarantine with this person, but how do a group of us protect each other? And so Gareth, I'll read out Gareth's quote. he talked about, in terms of sexual intimacy, it's now a smaller cohort of 5 people is the group of people he was engaged with at that point. But we all sort of agreed to go into lockdown. It's not really realistic to trust ourselves not to have sexual contact. That's going to be a massive challenge. There was a level of contract with them all. Do we buddy up with each other? Or I think bubbles were discussed at one point, and he says, look, this is probably against the rules. In fact, I think it's unequivocally against the rules to have more than one buddy. But you know, we have different desires that we satisfy. And at the moment, there are 5 different individuals we still continue to play sexually. But we all contracted that means we have very limited playmates. And we do this under the guise that we avoid shops, we avoid public transport. I think Gav's extract kind of speaks to the care that he and his partners thought about with each other, but also the impact they were having on a wider community. So even in breaking those rules and only having having more than one buddy, one sexual partner, they were limiting their interaction with others, recognizing that if they wanted this collective to continue, they made choices to mitigate risks, perhaps to others. And I think this is a really nice example of where some of the participants thought about the rules, and they thought about what does it mean to care for ourselves and others in a way that probably most public health practitioners would think this is terrible. This is a real risk on a community level. So that was just a real kind of whistle-stop tour through some of the data, some of the discussions or experiences of our participants. And I found that using citizenship, I'm probably not going to come back to any kind of proper analysis of citizenship, but I think it can help us see how not following or even adapting public health advice can still very much be grounded in self-care and care for others. And here I think this echoes a lot of, for instance, Asha Prasan's work with people living with HIV and treatment. And I think rather than being good or bad biosexual citizens, the queer men that we interviewed developed a whole array of ethically reflexive strategies to navigate a difficult terrain as they pursued cultures of sex and intimacy during the pandemic. And I think what I think we need to pay attention to what these citizenship practices can teach us in terms of navigating new public health harms like monkeypox or like different variations of COVID or who knows what's coming next. But that's me. Thank you very much for listening. I hope I've kept to time, and I will pass it over to Martha if I can find the button.